Hi everybody, welcome to the next EFCCA Patient Talks. Today we're delighted to present to you the results of a fistula survey. Today on our presentation we'll have the impact of perianal fistula in Crohn's disease on the quality of life survey that was recently completed. We are delighted to be joined by Professor Spinelli, who will join us live from Milan, Maria Stella, who's our EFCCA Project Coordinator, and Candida Cruz, who is from Portugal, will give us from a patient perspective. Just to take you through the format for the webinar is that we'll start with an introduction about the survey and the reason why the team decided to make it. We will then move on to a joint session with Maria Stella and Professor Spinelli in relation to looking at the results and a more in-depth focus on the top 3 countries. And then we will talk to Candida in relation to how to live and how she lives with it from a patient perspective. As always, we'll have a Q&A session. So if you have any questions, please pop them into the comment box and we'll get through them at the end of the presentation. Okay. Professor Spinelli.
Hi.
Hi, how are you?
I'm fine. Good afternoon. Good afternoon, everybody. And I'm really delighted to be here with you today. It's a real pleasure to join your webinar and to speak about this really hot topic for many people.
We're delighted that you can join us, and you're going to take us through why you decided to do the survey and what made you, the motivation behind it for patients.
Well, there is a small story about that I would like to tell you, and it is that about 10 years ago, I did my first collaboration with EFCCA, and it was exactly regarding and at that point, quite unregarded topic, which was patient's opinion and patient perception on surgery for IBD. And EFCCA was incredibly visionary in granting me the funds, a small amount, but it was enough to do the first survey on patient perception on IBD. And it was that's why I'm especially thankful to you guys, to EFCCA, to the president, to Salvo, to Luisa, to all of you, and to the patients that really support these, because I really believe that this is such a tremendously important topic, and it is especially important that we take this more and more into account, as not only in surgery, but even more in surgery, because traditionally we haven't had a tradition about trying to really understand that aspect.
So I'm going to hand over to you, but as a patient with perianal fistula Crohn's disease, I'm sure I'm going to be back with a lot of questions. So I look forward to later on.
Yeah, it will be fun. So I will try to go over some of the introductory slides, if it is possible to have my presentation on the screen. So thank you very much. Next slide, please. Well, I was just saying why it is so important to really gather and to really understand and let us being guided to patients' feelings, but even more to patients' perspective, expectations in this area. Because this is exactly the best example of where it is important to understand which the patient's goals are to really be successful in the treatment. Because it is very common, and we've been investigating this topic a lot, how much discrepancy there is sometimes between what is patient goal and what is the physician or the surgeon's expectation. So it is important to try to synchronize. To do this, it is essential to know what the patient is aiming for, what his or her situation is, and her or his expectations are in regard to that treatment, especially if the treatment is a less apparent problem, as it is very commonly with perianal Crohn's disease. So please, next slide. And as I was mentioning, it's not a new thing for us to really try to understand this. And this the basic concept is that we see a lot of patients, and we discuss with a lot of patients, even internationally, even within EFCCA. I have seen that in many nations is the same, that I listen to patients' opinion, and they bring me back this story very commonly. They have had surgery, and they tell me, if I would have known that I could have increased my quality of life through a procedure, I would have done it earlier. So I tried to understand why, and at the end I thought that there was a kind of a negative loop surrounding the perception of surgery by patients, and that was started by the fact that obviously we all would like to treat our disease only with medication, and sometimes I would say even in the for some aspect and some disease, also in the majority of the cases, it is possible to do so. But once we understand that there is the need for surgery, then very commonly in IBD, this is joined by the fact that we think surgery is necessary because we have failed or because the drugs have failed. And this leads to a bad attitude towards surgery. And this bad attitude leads to the need to delay as much as possible the surgical intervention, and this is especially true for IBD. And this leads to a more complex disease, perianal or even abdominal disease in Crohn's disease, or to worse general conditions in ulcerative colitis. Therefore, there is a higher risk in that setting for complication, and that higher risk for complication would close the negative loop by leading to a generally perceived more common negative perception, despite the very well proved and explained increase in quality of life advantages that surgery is often related with. So now that was the first amount of perception and of study of 2013, 2014. But since then, we've worked with our psychologists, very good psychologists from the university, from the Catholic University in Milano. And we have tried to look into the fact whether there could be some psychological predictors of indicators as a predictors of post-operative outcome and post-operative recovery in surgery. Why we wanted to know this, just to make it clearer, to understand with an interview before surgery whether the attitude of the patients towards surgery was positive, lots of expectation, or whether it was rather negative, so failure feelings and so on, and whether this would have an impact on how they recover after surgery. And this is a very interesting thing because it could also lead to some measures that we could put in place before surgery to optimize also psychologically the conditions to get the best out of surgery for the patient. Next slide, please. What is the size of the problem of the perianal disease? This is a very common disease, even if in Crohn's patient, even if sometimes this does not really come to the surface and is not that well known, but it really affects about 1/3 of Crohn's disease patients. So really a lot of our patients. Sometimes this is even the first sign of diagnosis. And even before that, the patient gets a real diagnosis, then if you ask her or him, they would tell you that sometimes they had previous fistula or previous problems in the perianal region. So it is important to know, even for this further potential advantage of allowing a suspect of the disease in a moment in which the abdominal part, for example, is silent. Next slide, please. It is important also because perianal fistulizing Crohn's fistula disease is really very often the first sign of a more aggressive phenotype of the disease. And it is important because once we know and recognize this, we can optimize our medical therapy in terms and in the direction of being more effective or more aggressive. Next slide, please. It is a neglected problem, and it is a neglected problem because the patient first, he himself or she herself does not always want to speak about this, sometimes because they could also not be aware of the fact that this is a common pattern of presentation of disease. Next slide. Next click. Yes. The gastroenterologist sometimes doesn't want to look into that area. He can be not completely confident to look into that area. And the surgeon, next slide, sometimes he's too occupied into thinking at the nice technique and so on, and does not really listen to the patient sometimes. Next slide. So this leads to the fact that the burden on quality of life of Crohn's disease is heavier for fistula than in the general population. Next click. And these are the major contributors: abdominal pain, nausea, vomiting, diarrhea, weight loss, and malnutrition. Next slide. But the question is, and this is also one of the topics of this survey, does the adding of the quantum of the perianal fistula further contribute to this decrease in quality of life? Next slide. So this is what we will be talking about, and this is what the survey is focused on. So now I am happy to leave the stage to my friends of EFCCA in order to allow them to present the results of this interesting study.
I think, Professor Spinelli, thank you for that. But I actually think you're also going to stay on the stage as we're joined by Maria Stella, just to take us through the results of the survey. So,
sure.
Thank you.
Hello, everyone. Hello. Thank you. Thank you very much. Thank you, Professor Spinelli, for the great introduction. So I'm going to share my screen. Just let me know if you can see it. I think so. Okay. Great. So in the next 30 minutes, we are going to share the main findings of this survey together with you. And the infographic contains a lot of data. We will upload it in the next few days also on the EFCCA website. So we will be able to see all of each part of the infographic. Today, we will share with you the main outcomes of it. So the survey was about the patient perspective on the impact of perianal fistulas and complex perianal fistula in Crohn's disease on quality of life. And the survey was in a partnership with Takeda, and it was done in 2019. We have received 820 responses all over 33 countries in the world, 33 countries, and it was translated in 11 languages. It's one of the most. It's a self-selective patient survey. It is one of the largest of its kind, because we received a lot of responses, and it's one of the most comprehensive survey around the patient's perspective of this very bad manifestation of Crohn's disease. So totally, here on the left, you can see the list of countries from where we received the highest number of responses. So 820 in total. The leading country is Italy with 162 responses. Then Spain, 160, followed by Portugal with 93 responses. I'm going also to share with you some meaningful insights from those three countries, because they represent the top three from where we received the very highest number. Here on the right, we have also another list of other few countries from we received also other few participants. So let's start with the first part of the questionnaire, and actually we I think you can see it better now. Sorry, so we asked one of the first questions, we wanted to know if respondents, when filling the questionnaire, if Crohn disease at that time, when filling the questionnaire, was active or not. And as you can see, for the majority of the respondents, Crohn disease was non-active. More than respondents who declared that the disease at that time was active. We have the 60% versus the 37.9. Here, I divided the two type of respondents of the survey. So we have patients with perianal fistulas and complex perianal fistula that are 532, and patients with Crohn disease only that are 288 in two different groups. I forgot to mention that we allow to be part of the survey patients with perianal fistulas and patients without, in order to be able to compare the two different groups to see if there are meaningful differences in symptoms experiencing by patients with perianal fistulas, and also in terms of impact of the manifestation of the disease in their quality of life. And we will see it together. And going back to the Crohn disease status, if we compare here the two different groups, we can see that Crohn disease was more active in patients with perianal fistula than in patients with Crohn disease only. You can see here we have a higher percentage for the first group. We also asked to our respondents how long they had been diagnosed with Crohn disease. And the patients with perianal fistula declare that Crohn disease for them, you can see here the two different bars, for them Crohn disease started earlier than patients with Crohn disease only. So it means that for this group of patients, Crohn disease had a longer duration. And you can see here the difference from the two bars. In blue, you will see always patients with perianal fistulas and complex perianal fistulas, and in yellow, patients with Crohn disease. Then, another question was about the information around the health conditions of respondents. On a scale from 0 to 10, we asked how much they felt informed about their condition. And I think that we have received good score for both of the groups, because we have the average of 8.07 for patients with perianal fistulas and 7.70 for patients with Crohn disease only. I think that's a good score. As you can see here from the little stars, the first group seems to be a bit more informed about their health conditions than the second group. If you go through also the three leading countries, Italy, Spain, and Portugal, we have pretty much the same situation in Spain as in Portugal. The group of patients with perianal fistula is leading in those two as well. And we have seen a very slight inversion in Italy, because as you can see from this graph, patients with Crohn disease declare to be a little bit more informed than patients with the perianal fistula. So that's a very little inversion. So going deeper, and let's go to analyze country per country. So the first one, as I was mentioning, it's Italy with 162 respondents, of whom 133 were patients with the perianal fistula and complex perianal fistula, and 29 were patients with Crohn disease only. Comparing again the two different groups in terms of Crohn disease status, Crohn disease was more active in patients with perianal fistula than in patients with Crohn disease. So it reflects the overall data that we have seen before. And if we talk about the number of years since the Crohn disease was diagnosed, here again, it reflects the situation of the general data. And Crohn disease was started earlier in patients with perianal fistulas. You can see here the 46.6% than in patients with Crohn disease only, with a 31%. Then let's move on to Spain, which represents the second leading country. with 160 participants. As you can see, I also fill the infographic with other information, but you will have time to look at them in the next few days on the EFCCA website. So again, in terms of status, here we have a very big inversion, because according to the responses that we have received, patients with Crohn disease only, compared with patients with perianal fistulas on the left, declare that their Crohn disease was more active when they were filling the questionnaire than patients with perianal fistulas. You can see the difference between the two percentage. We have 42.1% versus 35.2%. And when we ask how long they had been diagnosed with Crohn, again, it reflects the general situation. Patients with perianal fistula have been diagnosed, the majority of them have been diagnosed much before than patients with Crohn disease only. And I didn't mention it here, but it's important to highlight. Italy and Spain, they are the two leading countries which participated to the survey, but they also represent the majority of respondents with perianal fistulas and complex perianal fistulas, because in Italy we have 133, and in Spain we have seen 122 patients. So they represent the two highest number of patients with this manifestation of the disease. Let's move on with the third one, and the final one, that is Portugal, which 93 respondents, of whom 55 with perianal fistulas and complex perianal fistulas, and 38 were patients without perianal fistulas. Here, again, Crohn disease was more active in patients with perianal fistula than Crohn disease, 36.4% versus 15.8%. You also can see the difference between the two bars. The violet one is much more bigger than the other one on the right. And in terms of number of years since Crohn disease diagnosis, here there's a little inversion, because patients with the Crohn disease only without perianal fistula declare that their Crohn started before the same group of patients with Crohn disease and perianal fistulas, so more than 15 years ago. Okay, so after that, let's move on to the symptoms, and another part that also Professor Spinelli was mentioning, and that's another big part of the questionnaire. We asked our respondents which kind of symptoms they were experiencing when they were filling the questionnaire. So at that time, I remind you that it was on 2019. And here in this first graph, you can see the four most significant symptoms that patients were experiencing when they were filling the questionnaire at that time. And they are fever, pain in anal area, perianal leaking, and joint pain. And here again, you can, at the first sight, you can see directly from the blue bar, patients with perianal fistulas and complex perianal fistulas are experiencing more severe symptoms than patients with Crohn disease only. You can see how much bigger are the blue bar compared to the yellow ones. And also, particularly those two, pain in anal area and perianal leaking, those represent the two most recurring symptoms that particularly patients with perianal fistula they were experiencing when filling the questionnaire, and also they ever experienced in their life. There are the very two most recurring ones. You can see also the differences, how much are big between the two different group of patients. So it meets a lot in terms of experience.
I think Maria Stella, that this is really interesting as one of the most important aspects to really have a figure of which are the symptoms and how severe they are for patients experiencing them. What is also surprising to a certain extent is that there is an amount of patients, about the 13% of the patients that do not have officially any Crohn's disease that experience pain in the anal area. And this is, I think, something that makes the concept of perineal disease different from the concept of barely fistulizing perineal disease, because we know that there are a number of manifestations of Crohn's disease in the region of the anal canal that are not only related with the presence of a fistula.
Thank
I
you,
think that
Professor.
many patients have this.
Thank you, Professor, for your insights. Thank you. That's right. This is something that we also are seeing in the other 3 leading countries, also in Italy. So we have the 24.1%, that it's another important percentage of respondents. And here as well, the situation pretty much follows the general fever than patients with perianal fistula. And if we move on to Portugal, it's the same than the general outcomes. So what it's really impressed, it's the huge difference between the 2 bars in these 2 symptoms. So also Crohn disease are experiencing them, but patients with perianal fistula experience them a lot, much more than them. It's really impressive. And okay, let's move on to another important part of the survey. That's the impact of the perianal fistulas on quality of life, on relationship, on social life, and on work life. So in this case, we ask on a scale from 0 to 10, how much patients they felt that their disease had an impact on their quality of life. And you can see again from the bar that patients with perianal fistulas rated a greater impact on their condition on all of life areas, which are quality of life in general, relationship with family and friends, relationship with partners, so the intimacy, the impact on social and on work life. So the bars are higher for what concerns patients with perianal fistulas, but there's another aspect that it's also important here, is that even patients with Crohn disease only reported very high score in this question. So we don't see any yellow bar equal to 0. So it means that also Crohn disease itself has an impact on the different life areas. And this is something that another aspect that is really interesting to take into account.
I think, Maria Stella, that here it plays a role also how the question was perceived by the participants, because if you have to isolate the impact of your disease, it's really difficult, because what is the impact of only the perianal symptoms in comparison to the general impact of the disease? I think that that this might be one of the reasons why there is let's say, a lower than expected impact of the add-on of perianal disease on the overall restriction or quality of life regarding these important aspects of the life of people. So anyway, it is clear that in all of the considered aspects, there is still a higher bar when there is an add-on of a perianal disease. So this is pretty clear and very consistent in all of the categories. I think that this is still super important, and obviously it is more important the more it is the symptoms in the perianal region are important, and we know how much different they can be from person to person. For some people, there can be also only a very small fistula, which is maybe only causing a very limited discharge every up and then. And other people have the same tag of perianal disease, perianal Crohn's disease, but have a destroying phenotype with super complex abscesses and multiple fistula. So definitely, we also have to remember that it is not only one clinical picture, but it can have a huge variety.
Okay, great. Yeah, it's very individual based, this bad manifestation of the disease. Okay, thank you, Professor Spinelli. And now we are going deeper into each of the life areas that we have analyzed during the survey. And starting from the first one, in terms of impact on the overall quality of life, we can see that patients with perianal fistulas feel much more unhygienic than patients with Crohn's disease only, which feel uncomfortable more than patients with Crohn's disease, and they feel less self-conscious of their body than patients with Crohn's disease only. And this can be quite obvious, let's say, that this can be very, very obvious. In terms of impact of relationship with family and friends, they declare that they feel more guilty about their condition when they are around family and friends. They are not feel comfortable. And they also have an increased difficulty to talk with family and close friends about their condition. Again, when we talk about the intimacy, the aspect that we have analyzed are a lot, and those have been represented by the most significant ones, that for the relationship with partner are a lot, and they are as following. The patients with perianal fistulas declare to avoid having more sex more often than the other group of patients. They ended relationship more often. They avoid to have intimate relationship. They had more arguments with partner than patients with Crohn's disease, and they felt more inadequate to partner. They experienced, and they were experiencing, to have partner feeling disgusted by their condition, or partner who refused to have sex and intimacy more often with them. They also avoid to date more, and they also, and we wrap up this conversation, say they have marked limitation in sexual activity more than patients with Crohn's disease only. So the impact is huge. Also in social life and in work life, they declare to be unable to play sport more often. They carry a personal hygiene kit more often than patients with Crohn's disease only. You see here the difference between the two bars, 47.7% versus 25.7%. They declare to be much more aware of the access to clean toilets than patients with Crohn's disease only. And they also responded that they had to change profession, they had to change their job quite often and more often due to their condition more than Crohn's disease. So this is an insight from the tabs that we have seen before. And so the impact is really huge in each of the different life areas. And if we go deeper, the three leading countries, in Italy, it's overall it's pretty much the same. We have an exception in terms of the impact on relationship with partner and impact on work life. That we have a slight differentiation within the two groups. I don't know if there's a reason behind it. It's those are the data according to the respondents that we have received. In Spain, it's quite singular, as the presence of the perianal fistulas had a smaller impact on each life area. So the blue bar is a bit lower than the yellow bar. So it means that the patients with perianal fistulas reported a smaller impact of the disease on quality of life. This is for Spain. Portugal, we conclude with the third country, and more or less it reflects the general situation, except for the overall quality of life. You can see a very tiny difference between the two bars, and relationship with family and friends. This second one, we have an inversion for Portugal. Okay, so we have concluded the presentation with the countries. Now I want to talk for other 10 minutes for the rest of the presentation about another meaningful differences that we are seeing analyzing this data, the difference between women and men. When we ask what were the list of significant symptoms of Crohn's disease that women and men have ever experienced in their life, this is the list that we have received. Those are representing only the most significant symptoms, statistically speaking. And there were cramps in the stomach area, loss of appetite, joint pain, and fatigue. We also asked to the same respondents what were the list of symptoms they were experiencing when filling the questionnaire, and they were the same. The most significant ones were the same of the ones they experienced in the past. And here you can see the image of the woman, that it's a little bigger than men, to highlight how much women experience those symptoms significantly more than men. So each of them is experienced by women much more than in men. You can see the difference from the 2%. And over the years, we have seen that from the left to the right, they have decreased. So maybe they started bigger, and then when they were filling the questionnaire, they declared to have it less compared to when the disease started. But it's always women, there's always women, the gender, who experience them significantly more. And if we talk about the most significant symptom of perianal fistula, instead of that one related to Crohn's disease, was the fatigue. The most significant one is the fatigue. That is recurring also in one of the most significant symptoms in Crohn's disease. And so we can assume that women with Crohn's disease only, with perianal fistulas and without perianal fistula, suffer significantly more from fatigue than men. And that was quite clear for us. And if we talk about only Crohn's disease or perianal fistulas, so women are the group which suffer much more from fatigue than men. And let's conclude this presentation with another graph regarding the impact of the disease on the different life areas that we have seen also before. And here we compare women and men. So previously we compared the two groups, patients with respondents with perianal fistulas and patients without perianal fistulas. Here we compare the women and men, and let's see again how much women reported a significantly greater impact of perianal fistula in all of the life areas. See, the violet bars are bigger than the blue ones. So there's a little difference, but it can be significant. Okay, I finished with my presentation, and those are other few lines that I wrote about the survey. I hope it will be, Professor Spinelli, a good starting point for EFCCA to speak with medical experts, and other pharmaceutical companies and other stakeholders, and to try to find a meaningful way to help patients with perianal fistula.
Yes, I think we have a lot here, a lot of food for thoughts and for discussion, and it is extremely interesting. A lot of the aspects that you raised, a lot of the points that you raised. It would be great to now ask the participants of this webinar to just to tell us what is interesting, intriguing for them, and what eventually they have as question. I think that one of the most striking points that this survey has the merit to bring to the light is the fact that there is an additional burden related with the presence of Crohn's disease in the already very well demonstrated burden of Crohn's disease. So especially on social aspects, on personal aspects, and on let's say work aspects, I think that, and intimacy. So we should really recognize that this survey has brought these important topics to the with a kind of a numeric and objective arguments to the discussion. This is something new, and I'm really pleased that there is more and more interest towards these such aspects that, as I said at the very beginning in the introduction, this is incredibly important in even when we consider, for example, let's think, you mentioned the pharma industry. When we consider to design, for example, a trial to know whether a drug or a therapy or a strategy is better than another, what is the endpoint that we decide? If we take the wrong endpoint, if we take, for example, an endpoint such as an anatomical healing, which is maybe definitely a very important one, but we don't consider in the same study the aspects related with the patient perspective, then we would miss a lot once we then go back to the, we bring to earth, let's say, the results of that trial. So it is important that, and this is also why the vast majority of the studies now go towards inclusion of patients in the discussion when there is a planning of the outcome measure. And this is also why this survey really will help. I'm really confident that this will help a lot in the future for considering that when the table of the discussion will be on such aspects. So I have seen some questions popping up from, I think, from Facebook.
Thank you, Professor Spinelli. I think we will come back to the questions later. Ciara, right? And now I give you the floor for the next presentation.
Yes, so we're going to speak to Candida now from Portugal, who's going to provide us with a patient perspective as well. And again, Professor Spinelli, there has been questions coming in, and if there's any more, please just comment, and we will go through them at the question and answer side. Thank you. Candida is on mute. It's always the problem. You're on mute. So we'll just get Candida off mute from Portugal, who will join us. I think a lot of us have probably a lot of questions in relation to the survey, so we will have it up on the website as well, to allow people to have an in-depth, and I think it will help a lot of patients. It's good to see the quality of life coming into aspects from so many areas of IBD, both from the Crohn's and the perianal fistula. So it'll be interesting. Please put your questions down. I'm going to try not to hog any questions as a patient. So actually, we just have, sorry, this is the joy of live. We've just lost Candida for a second. I suppose I am also a patient of perianal fistulizing Crohn's disease. I forgot the complexes in there as well. So I think it's very interesting to see the results, because it's something that as a patient, you have Crohn's disease, but you also have this element, which a lot of people don't understand. So what we'll do at the moment, just until we see if we can get Candida back up, we'll go through some of the questions and again, try and get some answers and some insights from Professor Spinelli and Maria Stella. So I'll welcome them back on. This is a subject close to my heart, so I could talk all day about it. So I suppose one question that we had in at the time was, is there a reason why more women show more significant symptoms than men? Is there a medical reason, or is it just the fact that that was the breakdown of the survey?
Well, my opinion is that there is no medical reason for that. I think that it might be something from the survey, even if the result is pretty consistent. I have to say, among different populations, even in the different countries, is pretty consistent. But I cannot say I mean, I can see very clearly why the social aspect of the disease is more apparent in women, and this is also for a medical reason in a way, but not why the symptoms should be themselves, not the perception of the burden of the symptoms, but the symptoms themselves. There is no reason why they should be different, but the perception is related with the fact that anatomically, to have the disease near to the anal canal would be much more impairing for a woman, because it's difficult to hide it in the intimacy, while it is much easier to hide or to neglect and to make the partner not even aware of that for a man. And I think that this explains the difference from the aspect of the perception of the impact of the symptoms, but not of the symptoms themselves.
Not of the symptoms themselves. So we have Candida back. Candida, are you there?
Yes, I'm here. Can you hear me now?
We can hear you loud and clear.
Okay, I'm so sorry for
welcome
this
back.
Confusion. Okay, thank you. Hi, everybody. Good afternoon. As Ciara told you, I'm Candida Cruz. I'm a patient, and I'm vice president of Portuguese Association of Crohn and Colitis of IBD. First of all, I would like to thank EFCCA for inviting me to participate in this webinar. On the other hand, I would like to congratulate EFCCA for all the great work it has done during the years regarding IBD patients. As a Crohn patient for 32 years, these surveys are for me very important, as they are a way to give the patient a voice, to allow us in the first person to convey our experiences and our feelings. And I think it is why we see such a strong adherence of patients to these surveys. For me, this one was particularly important, as I suffer from perianal fistulas, and like the vast majority of participants, I feel that this is the most difficult complication of Crohn's disease, the one that most affects my personal, professional, and social life, and the one that caused me the most suffering and insecurities, as we see in the survey. I have a great expectation that this survey will result in a better and deeper understanding of this problem. And I hope it will generate solutions that allow us to live with more quality. To finish, I don't know if I can make two questions direct to Professor Spinelli. Can I? I would like to ask Professor Spinelli, to finish my intervention, what do you think makes a patient with Crohn's fistulizing disease isolate himself, and most of them hide his illness from his friends? What do your patients tell you? And I have another one that I think is very important for all patients that suffer from perianal disease. when is expected a truly effective and accessible treatment for all? Thank you.
Well, thank you, Candida. I think that these are really difficult questions. The first one, what the patient tell me that makes them isolating from their friends or social environment, is basically because they have some limitations related with the disease that go from less commonly. It is related with the pain, because usually the pain, once the abscess is drained, is not there anymore. But basically, the ones that suffer the more are the ones in which there is a problem with dealing with the control of the sepsis, because those are the cases that might require also a stoma. And their fears do concentrate mostly on that, while once they have they compare the situation of not having a completely drained sepsis with the pain related and with all the problems related with that, the secretions uncontrolled, the lack of control of the muscle because of inflammation, because of destroying of destruction of the sphincter apparatus related with persistent sepsis. Once they compare it with the stoma, they are usually extremely relieved after that. And these are also a certain amount of the patients I was telling you about at the beginning when I mentioned the huge gratitude that and feeling of getting better that patients do experience after most of the surgical operations. Regarding when there will be something really making the difference for the patients, especially for perianal patients, the key there is related with the control of the inflammation, as it is in the bowel disease, so in the luminal disease. So I'm pretty sure that the same solution that will be efficacious for putting under control the luminal inflammation will as well be the key to completely address the perianal disease.
Thank you so much for your answers.
Are there more questions coming from the audience or from the studio?
Hi, there is, Professor Spinelli, there is. What is the success rate or the average success rate for surgery with perianal Crohn's disease?
Good question. If you ask to the surgeon or the surgical publication, you can find rates of success very high, up to 70-80%, but this is not the reality. And the really good studies and the really honest surgeon will tell you that there is no option that will grant in general a percentage of healing higher than 50 to 60%. Then obviously you can accumulate the percentage of success after by putting one operation after the other, and then at the end there is an increasing success if you combine different strategies, but it is not much higher in the real world than what I told you.
And I think this is could be our final question. And I think it comes on from Candida as well. The survey shows that there's an increase on people, I suppose, being hesitant and talking with friends and family in relation to this. Is there a kind of easy way to explain what actually perianal disease is? Because obviously as patients, we probably understand it a bit more, but is there an easier way of describing it for those that don't know that may make it easier in the circumstances?
Well, it is inflammation. It's the difference between inflammation and infection. I think that this is important, that people everywhere are familiar with abscesses, because these are something that can happen to people even not having Crohn's disease. So maybe speaking about there is an infection, and we are trying to get rid of that with operations and with drugs, as it is for other similar conditions.
Okay. Thank you so much. I would like to thank you, Professor Spinelli, for all your help with and your continued work with EFCCA over the years. I'd like to thank Maria Stella as well for the amount of work she's put into this survey, and Candida, if she's there as well, for representing all the patients around Europe. So thank you all for joining us, and we look forward to seeing you at the next EFCCA Patient Talks. Thank you.
Thank you very much.
Thank you.
Thank you. Bye-bye.
Bye, Candida Professor. Goodbye. Bye, Ciara.
Goodbye.
Bye.
Bye-bye.
Thank you.